Australians with families overseas have endured almost 18 months of separation as Australia's borders closed. Researchers have implemented a world-first study into the mental health impact of being kept apart from loved ones without knowing when you'll see them again.
The birth of Adelaide doctor Yoko Tomita's third child was also supposed to see the arrival of her mother from Japan.
I was expecting my mother to come across and give me some physical help around the house while the daughter obviously grows up a bit and settles.
But worried about whether her parents could get in or out, it was decided the trip was too risky.
Not having her around was reasonably hard, both physically and probably emotionally.
And she's not the only one. COVID's left millions of us cut off from loved ones. Now researchers here are looking at long-term mental health impacts of that separation.
So we're asking questions about depression, about anxiety, about feelings of hopelessness, about feeling lonely.
Among those who've replied to the study so far, couples stuck in separate countries, Australians missing parents and grandparents, and people who've had to put a big move down under on indefinite hiatus.
These aren't people that are just trying to come here for a holiday or something like that. These are people whose lives and their future plans have been completely tipped on their head. And they're trying to make sense of what to do next.
Some of the responses have just been heartbreaking.
They're hopeful the findings will form part of the decision-making when the borders start to reopen.
We'd love for the government to really consider mental health and mental well-being when it makes decisions around the roadmap going forward.
Researchers are now looking for more people to take part in the survey.